Have you ever stopped for a moment and asked yourself a question that many men are too embarrassed to say out loud? If you're over the age of 50 or 60 and you still masturbate, is it helping your health, or could it be quietly causing problems you don't even realize? It's a question I hear far more often than you might imagine. Many men in their 60s, 70s, and even beyond continue to enjoy self-pleasure, yet deep inside, they carry uncertainty, guilt, or confusion. Some believe it weakens the body over time. Others worry it may damage the prostate. Many fear it could reduce their ability to perform with a partner or somehow make them less masculine. The truth is, these concerns are incredibly common, but very few people are willing to discuss them openly. Today, we're going to change that. Together, we'll separate myths from medical facts and explore what science really tells us about masturbation later in life. We'll look at it from a biological, emotional, and practical perspective so you can understand exactly what it means for your health as you age. I'm Dr. Rose, a board-certified urologist with nearly a decade of experience caring for men's urinary and sexual health. Throughout my years in clinical practice, I've spoken with thousands of men who have quietly asked the same questions you're probably asking yourself right now. I encourage you to stay with me until the very end, because what you're about to learn may completely change the way you think about your body, your sexual health, and even your confidence as a man. Before we continue, I'd like to ask you for one small favor. If you appreciate honest, science-based health information without unnecessary fear or exaggeration, take a second to press the like button. It helps this video reach more men who may be searching for trustworthy answers but don't know where to find them. I'd also love to hear from you. Leave a comment below and tell me which country you're watching from. It's always inspiring to see this growing community of men joining us from every corner of the world to learn how to stay healthier and stronger as they age. And if you haven't already, subscribe to the channel and turn on notifications so you never miss our weekly discussions about men's health, healthy aging, vitality, and living with confidence after 50. Now, let's get into today's conversation. Here's the first thing I want you to understand. Masturbation is not automatically harmful. At the same time, it isn't automatically beneficial either. Like many things in medicine, the answer depends on how it's practiced. Think of it as a tool. A tool can build something valuable when it's used correctly. The very same tool can also cause damage when it's used carelessly. The outcome depends entirely on how you use it. One reason this subject creates so much confusion is because we've all grown up surrounded by conflicting opinions. Years ago, many traditional doctors believed masturbation drained a man's energy, weakened his body, or even harmed the prostate. Today, on the opposite side, some health influencers claim it's almost a miracle cure for every problem related to aging and sexual health. Neither extreme tells the complete story. As is often the case in medicine, the truth lies somewhere in the middle. Modern scientific research paints a much more balanced picture. Current evidence suggests there are at least 10 meaningful health benefits that older men may gain from healthy self-pleasure. At the same time, there are also around 10 important risks that can develop when it becomes excessive, careless, or replaces other important parts of life. Understanding both sides is the key to making informed decisions. If your goal is to grow older while maintaining your confidence, protecting your prostate, preserving your sexual function, and enjoying a better quality of life, then you need the complete picture rather than myths or internet rumors. Over the years, I've had countless patients in their 60s and 70s wait until the very end of an appointment before quietly asking a question they were too embarrassed to bring up earlier. They would lower their voice, glance around the room, and ask, "Doctor, is it normal that I still masturbate?" Every single time, I reassure them that it's a valid question and one that deserves an honest medical answer. These conversations matter because masturbation isn't just about pleasure. It connects directly with prostate health, erectile function, blood circulation, hormone balance, pelvic muscles, emotional well-being, and even long-term quality of life. Unfortunately, many men leave medical appointments without ever discussing these concerns because they feel ashamed or assume the topic isn't appropriate. Today, we're going to have the conversation that many clinics never take the time to have. I'll explain the evidence in clear, simple language, without judgment, and without unnecessary fear. First, we'll go through 10 surprising benefits that healthy masturbation may offer aging men. After that, we'll discuss 10 potential risks that every man should understand so he can avoid problems before they begin. By the end of this discussion, you'll have a practical roadmap that allows you to approach this part of your life with confidence, balance, and peace of mind instead of guilt or uncertainty. So if you're ready to replace myths with facts and make better decisions for your long-term health, let's begin with the very first benefit. And it's one that many men don't fully appreciate until they experience changes with age. Benefit number 1 is that regular masturbation can help maintain the health of the penis itself. Many people think an erection is simply a sign of sexual desire, but medically, it's much more than that. An erection is actually an important biological process that keeps penile tissue healthy and functioning properly. When blood flows into the 2 sponge-like chambers inside the penis, known as the corpora cavernosa, those tissues expand and stretch naturally. This stretching helps preserve elasticity, nourishes the cells with fresh oxygen, and supports the flexibility that allows healthy erections to continue later in life. Without regular erections, whether they happen during sleep, with a partner, or through self-stimulation, those tissues gradually become less elastic. Over time, they may stiffen, lose flexibility, and become less capable of trapping blood effectively. As a result, achieving firm erections can become increasingly difficult. A simple way to think about it is this. Just as your muscles become weaker when they aren't used, the tissues inside the penis also benefit from regular healthy activity. In many ways, masturbation can act like gentle physical therapy for your sexual health. Now let's move to benefit number 2, and this is one of the most researched topics in men's health. Masturbation may help support prostate health. This is an area that often surprises my patients because many have spent years believing exactly the opposite. One of the most well-known studies from researchers at Harvard found that men who ejaculated more frequently throughout adulthood had up to a 33% lower lifetime risk of developing prostate cancer. That's an impressive finding and one that has encouraged further research over the years. Why might this happen? Every ejaculation helps move fluid through the prostate gland. That process may assist in clearing older secretions, inflammatory substances, dead cells, and other material that can accumulate within the tiny ducts of the prostate over time. Think of it as flushing out a plumbing system before debris has a chance to build up. While ejaculation alone cannot prevent prostate cancer, maintaining healthy prostate function through regular emptying may contribute to a healthier environment inside the gland. For men over 60, when prostate enlargement and inflammation become much more common, this natural cleansing process may play an important supportive role. Benefit number 3 involves something many men rarely think about until they begin experiencing bladder leakage or weaker erections. I'm talking about the pelvic floor muscles. During orgasm, these muscles contract rhythmically and repeatedly. One of the most important muscles involved is called the pubococcygeus muscle, which forms part of the pelvic floor. These muscles help support the bladder, bowel, and sexual organs. The stronger they remain, the better they perform their many important jobs. Healthy pelvic floor muscles contribute to stronger erections because they help maintain blood inside the penis. They also improve bladder control, reducing the risk of unwanted urine leakage that many older men begin to notice. In addition, they help support ejaculation and overall sexual function. So every healthy orgasm provides these muscles with gentle exercise that may help preserve their strength over time. Benefit number 4 focuses on something that affects nearly every aspect of aging: stress. As we grow older, many men carry increasing emotional burdens, health concerns, financial pressures, retirement planning, family responsibilities, caring for aging parents, supporting children or grandchildren. All of these can place significant stress on both the mind and body. One of the body's primary stress hormones is cortisol. When cortisol remains elevated for long periods, it can contribute to higher blood pressure, poor sleep, increased inflammation, weight gain, and a greater risk of several chronic diseases. Research has shown that orgasm can trigger a noticeable reduction in cortisol levels. This creates a temporary state of relaxation that many men describe as both mentally calming and physically comforting. Lower cortisol doesn't solve life's problems, of course. But reducing chronic stress, even for a short period, supports healthier blood pressure, improved mood, and a better balance within the body's natural systems. Benefit number 5 is one that many people notice immediately, even if they don't understand the science behind it. After orgasm, your brain releases a powerful combination of natural chemicals that influence both emotional and physical well-being. These include dopamine, oxytocin, and endorphins. Each one plays a unique role. Dopamine contributes to motivation, satisfaction, and feelings of reward. Oxytocin promotes relaxation, emotional comfort, and a sense of connection. Endorphins act as the body's natural pain relievers while also creating feelings of calm and happiness. Together, these chemicals can lift your mood, improve mental clarity, reduce tension, and create a greater sense of emotional balance. For older men, who may spend more time alone after retirement, the loss of a spouse, or children moving away, this natural neurochemical response may provide an important emotional boost. Although it should never replace meaningful relationships or social interaction, it can help reduce feelings of loneliness and improve overall emotional well-being. Benefit number 6 may be one of the most practical health advantages of all. Regular self-examination through masturbation can help you become more familiar with your own body. When you know what feels normal, you're much more likely to recognize when something changes. Perhaps you notice a small lump in one testicle. Maybe you discover unusual tenderness, new curvature of the penis, changes in sensitivity, or an area that suddenly feels different than before. These observations should never be ignored. In fact, many men first detect early warning signs of conditions such as testicular cancer, Peyronie's disease, or other urological problems simply because they became aware of changes during routine self-stimulation. In that sense, healthy masturbation becomes much more than pleasure. It also becomes an opportunity for awareness. And in medicine, early awareness often leads to earlier diagnosis, faster treatment, and much better outcomes. The more familiar you are with your body, the more quickly you'll recognize when something deserves medical attention before it becomes a more serious problem. Now let's continue with benefit number 7, and this is one that almost every older man can appreciate, because quality sleep becomes harder to maintain with age. Many men over 60 tell me they wake up several times during the night, struggle to fall back asleep, or simply don't feel rested in the morning. What many people don't realize is that orgasm naturally activates several biological processes that prepare the body for deeper, more restorative sleep. After ejaculation, the brain increases the release of prolactin, while oxytocin remains elevated and cortisol continues to fall. Together, these hormonal changes create a powerful relaxation response. Your heart rate gradually slows, your muscles begin to relax, your breathing becomes steadier, the mind becomes quieter. That heavy, sleepy feeling many men notice afterward isn't simply psychological. It's a normal biological response. For older adults who often battle insomnia or restless sleep, this natural shift may help the body transition into a more restful night. Good sleep is far more than feeling refreshed the next morning. It supports memory, strengthens the immune system, improves heart health, regulates blood sugar, and allows the body to repair itself more efficiently. As we age, protecting sleep becomes one of the most valuable investments we can make in our overall health. Benefit number 8 is improved blood circulation throughout the pelvis. Most people only think about blood flow to the penis, but the entire pelvic region benefits from healthy circulation. Every erection increases blood supply not only to the penile tissues, but also to nearby structures, including the prostate gland, bladder, pelvic muscles, and surrounding connective tissues. Healthy circulation delivers oxygen and nutrients that every living cell requires. At the same time, it helps remove waste products that naturally build up through normal metabolism. When circulation becomes sluggish, tissues may receive less oxygen, inflammation may become more likely, and healing can slow down. Maintaining healthy blood flow supports the long-term health of the entire pelvic region. For older men, who naturally experience changes in blood vessel function as they age, keeping circulation active becomes even more important. Benefit number 9 is something that can directly improve confidence during intimacy. Masturbation can become a valuable training tool for learning better control over ejaculation. Many men experience premature ejaculation at different stages of life. Others notice changes after periods of stress, illness, or reduced sexual activity. Fortunately, the body can often be trained. One technique frequently recommended by sexual health specialists is known as the stop-start method. The idea is simple. As stimulation increases and you feel yourself approaching orgasm, you pause briefly until the sensation decreases. Then you begin again. Repeating this process teaches you to recognize your body's signals much earlier. Over time, many men develop greater awareness, stronger confidence, and improved control during partnered intimacy. Like any skill, this requires patience and consistent practice. But many men find that these techniques help reduce anxiety while improving overall sexual satisfaction. Benefit number 10 reminds us that sexual desire doesn't only exist in the body, it begins in the brain. In fact, the brain is often described as the body's largest sexual organ. Every thought, memory, fantasy, and emotional response involved in intimacy starts within the nervous system. When healthy sexual stimulation continues throughout life, the brain repeatedly activates these neural pathways. Just like exercising a muscle strengthens it, regularly engaging these circuits helps keep desire alive. If these pathways remain inactive for long periods, libido may gradually decline. Once sexual desire fades significantly, restoring it often becomes much more difficult. Maintaining healthy sexual interest isn't simply about pleasure. It also supports emotional well-being, confidence, relationship satisfaction, and overall quality of life. Those are the 10 potential benefits. However, medicine is always about balance. Anything that offers advantages can also create problems when used improperly. That brings us to the second half of today's discussion. Let's talk about the 10 risks every older man should understand. Risk number 1 is social isolation. Masturbation should complement a healthy life. It should never replace meaningful human relationships. Sometimes, especially after divorce, the loss of a spouse, or retirement, a man may begin relying entirely on self-pleasure while gradually withdrawing from emotional connection with other people. Over time, this pattern can increase loneliness, reduce opportunities for companionship, and negatively affect emotional health. Human beings are naturally social. Physical intimacy is only one part of a healthy relationship. Conversation, affection, trust, laughter, and emotional support all play equally important roles. When masturbation becomes a substitute for real connection rather than one part of a balanced life, emotional well-being may begin to suffer. Risk number 2 involves small skin injuries that many men underestimate. The skin of the penis is delicate. Using excessive force, prolonged friction, or masturbating without adequate lubrication can create tiny tears called microlesions. These small injuries may seem insignificant at first. However, repeated irritation can increase inflammation, cause discomfort, and make the skin more vulnerable to infection. Some men notice redness, burning, swelling, or soreness afterward without realizing that excessive friction is the cause. Fortunately, preventing this problem is usually very simple. Use a gentle technique. Avoid excessive pressure. If additional lubrication is needed, choose a high-quality water-based lubricant that reduces friction while protecting the skin. Comfort should always be your guide. Pain is never a sign that you're doing something beneficial. Risk number 3 is gradual desensitization. The human brain learns through repetition. If every experience follows exactly the same pattern, using the same grip, identical speed, identical pressure, or the same type of visual stimulation, the brain gradually adapts. Eventually, it may begin responding most strongly only to that specific pattern. When that happens, intimacy with a real partner can sometimes feel less stimulating simply because the experience is different. Fortunately, this isn't permanent for most men. The solution is flexibility. Avoid becoming dependent on one routine. Vary your technique occasionally. Allow your brain to experience different forms of stimulation instead of teaching it to expect only one specific pattern. Maintaining adaptability helps preserve healthy responsiveness both during self-pleasure and during intimacy with a partner. Now let's continue with risk number 4, and this is one that deserves serious attention because it can delay the diagnosis of important medical conditions. Sometimes a man notices that he can achieve an erection during masturbation without much difficulty, yet struggles when he is with a partner. Instead of asking why this difference exists, he simply assumes everything is normal because erections still occur occasionally. Unfortunately, that assumption can hide an underlying health problem that requires medical evaluation. Difficulty maintaining erections during partnered intimacy may sometimes be linked to emotional stress or performance anxiety. However, it may also be an early warning sign of conditions such as cardiovascular disease, diabetes, reduced testosterone levels, poor circulation, or other hormonal imbalances. Erectile dysfunction is often one of the body's earliest signals that blood vessels are no longer functioning as well as they should. In many cases, the arteries supplying the penis become affected before larger arteries elsewhere in the body. That means changes in sexual function may appear years before symptoms of heart disease become obvious. For that reason, never dismiss persistent erection problems simply because masturbation still seems possible. If you notice ongoing changes, schedule an appointment with your doctor. The earlier the cause is identified, the greater the opportunity to treat it successfully and protect your overall health. Risk number 5 involves something most men never think about at all: body position. Posture matters more than many people realize. If you regularly masturbate while sitting on a hard surface, leaning forward for long periods, or remaining hunched over in an uncomfortable position, you may place unnecessary pressure on an important nerve called the pudendal nerve. This nerve supplies sensation to the penis, scrotum, and much of the pelvic floor. Repeated compression over time may contribute to numbness, tingling, discomfort, or chronic pelvic pain. Although this doesn't happen to everyone, it's a preventable risk. Whenever possible, choose a comfortable position that allows your body to remain relaxed. Many specialists recommend lying down with adequate support rather than remaining bent forward or seated on a hard chair for extended periods. Your goal should always be comfort, not strain. Risk number 6 is emotional escapism. This topic goes beyond physical health and reaches into emotional well-being. Life after 60 often brings new challenges. Retirement can change your daily routine. Children may move away. Relationships evolve. Financial concerns may increase. health problems sometimes appear unexpectedly. During stressful periods, it's natural to look for activities that provide temporary comfort. The problem arises when masturbation becomes the only way you cope with difficult emotions. If every experience of stress, boredom, loneliness, frustration, or sadness automatically leads to self-pleasure, the habit may gradually become an emotional dependency rather than a conscious choice. Healthy coping requires balance. Exercise supports both body and mind. Time with family and friends strengthens emotional resilience. Relaxation techniques, hobbies, reading, walking outdoors, meditation, and meaningful social activities all contribute to emotional stability. Masturbation can certainly remain part of a healthy lifestyle, but it should never become your only strategy for dealing with life's challenges. Risk number 7 is guilt and shame. This may be one of the most emotionally painful risks because its effects often last for decades. Many older men grew up in environments where masturbation was described as sinful, dirty, weak, or morally wrong. Those messages often became deeply rooted during childhood and remained there long into adulthood. As a result, even when a man understands scientifically that masturbation is a normal human behavior, he may still experience overwhelming guilt afterward. That emotional burden can slowly damage self-esteem, increase anxiety, and create unnecessary inner conflict. Living with constant shame places stress on both the mind and body. If these feelings continue to affect your quality of life, consider speaking with a qualified counselor or therapist who has experience in sexual health. Having an open, respectful conversation can help separate outdated beliefs from current medical understanding. Many men discover tremendous relief when they finally allow themselves to view their sexuality with compassion instead of judgment. Risk number 8 is pelvic congestion caused by excessive frequency. Even healthy activities can become harmful when taken to extremes. Some men mistakenly believe that more is always better. In reality, the body benefits from moderation. Multiple sessions every single day over extended periods may lead to aching in the testicles, heaviness within the pelvis, temporary soreness, or general discomfort. These symptoms usually improve with rest, but they serve as reminders that every body has limits. Learning to recognize your own comfort level is an important part of maintaining long-term sexual health. There is no universal number that fits every man. Instead, pay attention to how your body responds. If discomfort develops, allow yourself time to recover before engaging again. Listening to your body's signals is always wiser than forcing a routine that doesn't feel natural. Risk number 9 becomes especially important for men who are still hoping to father children. Although fertility naturally declines with age, many men remain capable of conception well into later life. If pregnancy is your goal, ejaculation frequency deserves some consideration. Ejaculating every single day may temporarily reduce sperm concentration because the body has less time to replenish mature sperm cells between ejaculations. For many couples trying to conceive, doctors often recommend leaving approximately 2 to 5 days between ejaculations during the fertile window. This schedule generally allows sperm concentration to recover while still maintaining healthy sperm quality. Of course, every individual situation is different, so personalized medical advice is always best when fertility becomes a concern. Understanding how timing affects sperm production allows couples to make informed decisions and improve their chances of successful conception. Let's finish with the final risk, because this one has become increasingly common in today's digital world. Risk number 10 is becoming disconnected from real-life intimacy because of excessive dependence on pornography. Pornography itself isn't the topic of today's discussion, but it's important to understand how repeated exposure to highly stimulating and unrealistic content can affect the brain. Over time, some men begin relying almost entirely on extreme visual stimulation in order to become aroused. The brain gradually adapts to those unrealistic situations, making everyday intimacy with a real partner feel less exciting by comparison. This doesn't happen overnight, but when it develops, it can quietly affect desire, emotional connection, and sexual satisfaction within a relationship. The healthiest approach is balance. If you choose to use visual stimulation, don't allow it to become your only source of arousal. Keep your imagination active. Value genuine emotional closeness. Remember that real intimacy is built on communication, affection, trust, and shared experiences, not unrealistic expectations created by a screen. So, after looking at both the benefits and the risks, how can you use masturbation in the healthiest possible way? The first principle is finding the right frequency. There is no magical number that works for every man because every body is different. Age, overall health, hormone levels, relationship status, medications, and personal comfort all influence what feels right. For many healthy older men, masturbating somewhere between 2 and 4 times each week provides the benefits we've discussed without placing unnecessary strain on the body. The goal isn't to reach a specific number. The goal is to find a rhythm that leaves you feeling healthy, comfortable, and energized rather than tired or uncomfortable. The second principle is gentleness. Your body deserves care and respect. Avoid gripping too tightly or using unnecessary force. Take your time. Use a quality water-based lubricant whenever additional comfort is needed. Pay attention to your posture so you don't place unnecessary pressure on your pelvis or lower back. Healthy sexual activity should never leave you with pain or injury. Comfort is a sign that you're treating your body well. The third principle is awareness. Stay connected with your body and pay attention to changes. If you begin noticing pain, persistent difficulty with erections, unusual lumps, changes in curvature, bleeding, discharge, or anything else that doesn't seem normal, don't ignore those signs. Masturbation should never become a reason to postpone medical care. Instead, let your familiarity with your body help you recognize when something deserves professional evaluation. Early diagnosis often leads to simpler treatment and much better outcomes. The fourth principle is integration. Healthy sexuality is only one part of a healthy life. Continue investing in your relationships. Spend time with family and friends. Exercise regularly. Eat nutritious foods. Sleep well. Manage stress. Keep your heart healthy. When masturbation exists alongside these healthy habits, it becomes one small part of an active and fulfilling lifestyle rather than your only source of comfort or satisfaction. The fifth and perhaps most important principle is your mindset. It's time to let go of unnecessary shame. There is absolutely nothing embarrassing about continuing to experience sexual desire in your 60s, 70s, or even your 80s. Your body hasn't failed you simply because you've grown older. Your sexuality does not suddenly disappear after retirement. Desire is a natural part of being human, regardless of age. When practiced responsibly and with self-awareness, masturbation is simply another way of caring for your body. It can help maintain healthy blood flow. It may support prostate function. It allows you to remain familiar with changes in your body. It can contribute to emotional well-being and help preserve confidence as you continue aging. Gentlemen, I want to leave you with one final thought. Growing older does not mean giving up your dignity. It does not mean surrendering your confidence. And it certainly does not mean your sexual health no longer matters. Every healthy decision you make today becomes an investment in the quality of your life tomorrow. Whether that decision involves exercising more, improving your diet, managing stress, scheduling regular medical checkups, or understanding your own sexual health, each small step helps protect your independence and vitality for years to come. So what is the most important message from today's discussion? Masturbation is neither your enemy nor your miracle cure. It is simply a tool. When used with moderation, awareness, and good judgment, it can support healthy aging and become one part of maintaining your physical and emotional well-being. When practiced carelessly or allowed to replace healthy relationships and healthy habits, it may begin working against you instead. The choice ultimately depends on how you care for your body and how thoughtfully you approach your health. I hope today's conversation has answered questions that many men have quietly carried for years. If you found this discussion helpful, I'd truly enjoy hearing from you. Leave a comment below and tell me which fact surprised you the most. Your experience may encourage another man who has been searching for reliable answers but has been too embarrassed to ask. If you haven't already, please take a moment to like this video, subscribe to the channel, and turn on notifications so you never miss our weekly conversations about men's health, healthy aging, prostate care, longevity, and living your later years with confidence. Always remember this: age is never the end of desire. It is never the end of strength, and it is certainly never the end of living a full and meaningful life. With knowledge, moderation, and consistent healthy habits, you can continue protecting your body, preserving your confidence, and enjoying life for many years ahead. Thank you for spending this time with me today. Take good care of yourself, stay healthy, stay strong, and I'll see you again in the next video. I'm Dr. Rose.